Hi, this is Dr. Sharaf. I'm a consultant pediatric radiologist in the University Hospital of Leicester. Today I will talk about pediatric plain film trauma, but before starting to describe the various type of trauma or bone injury in pediatric, I will give you some hints about the radiological anatomy of the bones in children. The radiological anatomy of the long bones in children divided into four compartments. First one is the diaphysis, represents a primary ossification center. Metaphysis, epiphysis represents a secondary ossification center, and physis represents a growth plate. Besides these four compartments, there is a bone cortex, medullary cavity, and joint spaces, which are parts of skeleton, can help us to identify or describe bone injury. Let's start with the first part, which is the diaphysis. We call it as the shaft of the long bones. Usually it's formed of a hard out cortex and inner bone marrow cavity. The second part is the metaphysis, which represent the wide portion of the long bones. Growth usually occur at this section and adjacent growth plate. The metaphysis is located between the diaphysis and epiphysis. The epiphysis is the rounded portion at the end of the long bone and separated from the metaphysis by lucent physis. Once the growth plate has fused, the epiphysis and metaphysis are joined together. Physis, we call it as the growth plate found in the bone, undergoes the endochondral ossification and usually represent a radiolucent line between the metaphysis and epiphysis as shown. The bone cortex or cortical bone appears as a radiopaque white line on the radiograph as the outermost layer of the bone. The medullary cavity is the central cavity of the bone shaft where the red marrow and yellow marrow are located. The medullary cavity is also known as marrow cavity. The joint space is the space between the two bones and usually contains the epiphysis, joint fluid, and articulation. Here are a couple of quizzes to test your knowledge about the radiological anatomy of the long bone. But before starting the quizzes, let me to tell you about the name of this bone. This bone is a left femur. Why? Because you can see some pelvic bones in the upper part of the radiograph and part of the left knee joint on the lower part on this radiograph. So the question is, which bony part is highlighted with blue? Yes, it is epiphysis. Why it is epiphysis? Because it is rounded in shape, situated at the end of the long bone, and separated from the underlying metaphysis by a radiolucent line representing a growth plate. The second quiz is the bone named is left humerus. Why? Because you can identify the left shoulder joint on the upper part of the image and elbow joint on the lower part of the image. So which bony part is highlighted with red? Yes, it is metaphysis because it is the most widest part of the bone. Besides, there is a radiolucent line separated the metaphysis from the overlying epiphysis, which represents a growth plate. The second part of my lecture is about fracture, how to identify and describe the fracture. The definition of the fracture is simply is discontinuation of the bone resulting from external mechanical forces. There are many ways to approach the assessment of the fracture on the radiograph, and this the simplest one. First of all, we should describe the radiograph and which bone is involved. then the type of the fracture, where is the fracture, and if there is any displacement, and if there is any something else going on like involvement of the joint space, if there is any another fracture or any underlying bony lesion. Three types of fractures. The first one is complete fracture, where the fracture extends all the way through the bone, and this including transverse, oblique, spiral, and comminuted fractures. The second one is incomplete fracture, as the whole cortex is not broken. This includes bowing, buccal, and green streak fractures. And the last one is Sorta-Harris fractures, where the fractures involve the growth plate. The transverse fracture is a part of complete fracture where the fracture is straight across the bone. Here you can see the right clavicular transverse fracture. The oblique fracture is the oblique line across the bone, and here you can see there is an oblique fracture of the right humerus. The spiral fracture looks like a corkscrew, and here you can see a spiral fracture of the distal left tibia. The last one is a comminuted fracture. This type of fracture usually composed of more than two parts of fracture fragment, and if you can see here there are comminuted fracture of the medial malleolus of the distal right tibia, which composed of more than two fracture fragments. The second type of fracture is incomplete fracture. This includes bowing fracture, where the shaft of the long bone has been bent, and you can see here from radiograph there is bending of the shaft of the left radius. Beside this fracture there is another fracture of the distal ulna. The second type of incomplete fracture is a buccal fracture. This is the commonest fracture in pediatric, and it happens when one side of the bone buckles or bends but does not break all the way through the bone. As you can see from this radiograph, there is a buccal fracture of distal radius and ulna. The third type of incomplete fracture is a green stick fracture. It happens when a crack or break on one side of a long bone does not extend all the way through the bone. Here from the radiograph, you can see green stick fractures of the midshafts, radius, and ulna. The last type of fracture is Salter-Harris fracture. This kind of fractures involve the growth plate. Salter-Harris fracture classified into 5 types: type 1, 2, 3, 4, and 5. In next few slices, we will go through each type in details. For easy remembering this classification, you can use mnemonic SOTA. Letter S for type 1, where the fracture plane passes all the way through the physis. A for above, where the fracture plane passes across the growth plate, then through the metaphysis. Type 3 for lower, where the fracture plane passes through the growth plate down to the epiphysis. Type 4 through, where the fracture plane passes directly through the metaphysis, growth plate, and down through the epiphysis. Type 5, where the fracture plane causing direct damage of the growth plate without any displacement. Now we will go through each type in detail. Let's starting with fracture type 1, where the fracture passes through all the way through the growth plate and does not involve any bone, as you can see from this radiograph. Type 2 Salter-Harris fracture, where the fracture plane passes across the growth plate and up to the metaphysis, as you can see from this radiograph. Here, another radiograph showed that the fracture passes through the growth plate as well as metaphysis. Type 3, where the fracture plane passes through the growth plate to involve the epiphysis, as you can see from this radiograph. Here, another radiograph showed that the fracture plane passes through the physis and epiphysis with some displacement of the epiphyseal fragment. Type 4, Salter-Hals fracture, where fracture plane passes directly through the metaphysis growth plate and down through the epiphysis. Here you can identify the epiphyseal component of type 4 Salter-Hals fracture. This is a CT 3D reformatted image, and also you can identify the fracture line through the epiphysis. Lateral radiograph, and you can see the fracture passes through the metaphysis. Here the CT 3D reformatted image, and you can easily identify the metaphyseal component. The last type of the Salter-Hals fracture is type 5. This uncommon fracture occurs when the growth plate is crushed or compressed. The knee joint as well as ankle joint are the most joints to be involved by this kind of fracture. Other bone injuries in pediatric include an AI or non-accidental injury, occult injury, pathological fracture, and stress fractures will be discussed on another talk. Take home message. Bone x-rays are the fastest and easiest way to view and assess bone fractures, injuries, and joint abnormality. Determining fracture type is really important when looking at a fracture and trying to describe it, as this will help the orthopedic team to take further decision for management, either conservative treatment or operation. Thank you.